Okay, well, we're going to go ahead and get started. I know there's a few people that are still joining us, but don't want to waste any time. We're going to be talking about health and safety today. So good afternoon. My name is Diane Frenzel, and I am the program manager for the Delaware Readiness teams. And we're really excited to have you join us today as we talk about health and safety. This meeting is going to be recorded, and there is going to be a link to this recording that will be available after the meeting. Also, participants will also receive a follow-up email with the link and some other resources that will be available. So all participants have also been placed on mute so that we'll be able to hear our panelists as they're speaking. And so just to kick us off, I just wanted to give you a little bit of background on why we're holding this session. In June, the Delaware Readiness teams and Rodell conducted a parent survey just to better understand the needs of families during the pandemic. And so more than 1,000 Delaware parents did share their thoughts and feedback and experiences. And so some of the things that we learned from this was we learned that parents, caregivers, families are dealing with a lot during the COVID-19 crisis, and there are many questions that remain. We found that 84% of the parents reported stress level that was much higher or somewhat higher than usual. We found that 72% of the families reported that they, their child, or both of them missed healthcare checkups, medical services, medication, or home visiting services during the pandemic. We found that 87% of parents said that there were changes to their routine that have been very or somewhat disruptive for families and their children. And families also expressed that they're looking for more information in the areas of health and safety, mental health, and educational supports, as well as other resources for them and their families. So today we're going to explore the topic of health and safety. And we're holding a similar session to this that's going to be on mental health that will be coming up in September. And we'll provide some additional details about that at the end. And then we're also going to continue to send out resources and supports for children and families. So here are some additional things that you would need to know about this session. We're excited to explore the topic of health and safety, and as a parent myself of 2 boys, I know that there are things that can be done to help keep my kids as healthy and safe as possible during this time. And I'm still learning new things and new ways and how to do this every day, but I also continue to have more questions. And we're hearing this same thing from a lot of families, and so we thought it was really important to have some people that are out there experiencing it, some experts in the field, so that they can give us some of their insight on their knowledge. We are going to hear from 4 panelists who will provide us with an overview on recommendations, guidelines, and experiences related to the topic of health and safety during the pandemic. As a reminder, this session is geared towards families to provide that information on health and safety, and then give you the opportunity to ask some questions that you may have. So if you are a provider that has specific questions related to your program, we do encourage you to reach out to your licensing specialist. And we also will have the chat box feature, so please use that to type your questions in. You can type these questions in at any time, but we do want to hear from all of the panelists first. And then we will take time for the questions. So let me introduce you to the panelists. We have Jamie Mack, who is NPA Chief from Health Systems Protection at Delaware Division of Public Health. Our next 2 panelists are with Christiana Care. We have Todd Hartstock, who is a Senior Community Educator, and Heather Sermon, Registered Nurse with Wilmington Healthcare Center. And then we also have Lucinda Ross, who's president of Delaware Association for the Education of Young Children and is the executive director for St. Michael's School and Nursery. We welcome our panelists, and we are excited to get things kicked off. And so, Jamie, I'm going to have you take it away.
Okay. Good morning, everybody. I am going to try and share my screen so I can talk through some of the information. But just to let everybody know, I'm the Environmental Health Director with the Division of Public Health, and I have been working with businesses and schools and child cares and others throughout this situation. And, you know, we are one of the main resources that folks have for providing information about health and safety, face covering, social distancing, all those things. So we can get right into it. And face coverings are probably one of the most important things that we can do. And that is, anytime that we're outside of our house, anytime that we're with folks outside of our household unit, the face coverings become very important because that's the primary protection that we're going to have for both ourselves as well as to protect others around us. And it sounds a bit scary to say this, but one of the things that I try to encourage people to do is to assume that both myself and those around me are positive at this point, because the transmission of the virus is such at this point that, really there's probably no place that hasn't been impacted by a positive case. And by taking the mindset that ourselves and everyone around us might be positive, then it continually reminds us to be careful, to take, those precautions and to take the right steps. So with the face coverings, there's a couple of things we want to keep in mind. And we encourage people to wash or sanitize their hands before they put their face covering on, because one of the points, one of the most vulnerable moments is anytime we touch our face. And so putting the face covering on, if we haven't washed our hands, haven't sanitized our hands, that gives us an opportunity to transfer the virus to, our nose, mouth, and perhaps get sick at that point. You see a lot of people that are wearing the face coverings down around their chin, up on their forehead, down around their neck. Surprisingly, they're not as effective that way. So we want to make sure that everybody's wearing it, covering the nose and mouth. And then obviously you want to be able to breathe easily. If you're wearing one and you feel like you're struggling to breathe, you might want to try different materials, different styles, see that you can find one that you're most comfortable with. And then we want to make sure that we're not touching the covering, because that again goes to a place where we can transfer the virus to, the face mask or face covering to our hands and put ourselves at risk. We also want to not reuse disposable masks. Some of the masks, they break down a bit over time. As we breathe in and out, the material is not as effective. And then we also want to make sure that we know that face coverings, are not necessarily a complete replacement for social distancing. They're two things that work together to protect us. Hand washing and hand sanitizing, that's one thing that we can't stress enough. Anytime we have an opportunity, wash the hands with soap and water for at least 20 seconds. A lot of people have taken to using hand sanitizer as much as they can, and that's great. But we want to make people recognize and reinforce the idea that the hand sanitizer is not a replacement for hand washing. Hand washing is going to remove any of the material from our hands. It's going to be a little bit better protective barrier than hand sanitizer. So we are continually telling people that hand sanitizer is a great supplement to hand washing, but it's not necessarily something that we want to use as a replacement for it. Now, we get a lot of questions about cleaning and disinfecting. And, surprisingly, there's really not a lot of new things that we need to do here in terms of dealing with this virus. There is a list of disinfectants on the EPA website. You can find, most of these products, normal stores, they're products we're familiar with. What we're really talking about is a higher frequency of cleaning. Maybe we want to wipe down counters, once a day. If it's a school, daycare, business, things like that, we get into some of the high contact surfaces like light bulbs and doorknobs, and we want to wipe them down every couple of hours. We just want to do all of this a little more frequently than we normally do to make sure that we're protecting ourselves. And then we go to the social distancing. And this is a tough one because we're so used to being with people that to have 6 feet, between us and people that we're normally around is very tough. But it's going to be something that we're going to need to do to protect ourselves. And we have talked about 6 feet in a lot of cases, but when we talk about some environments like choir singing, sports events where we've got coaches yelling and things like that, then we're really looking for longer distances. And some of the recommendations for singing go out as far as 13 feet as opposed to 6 feet. And if you're going to be closer, if you're singing and you're going to be within 6 feet, if you're going to be within, even 10 feet if you're singing, we want to wear a face covering. If you're out and about and you're going to be within 6 feet of people, we want to wear that face covering to make sure that we're being protective. And I know I tend to talk pretty fast because I've been talking about these things for a couple months now, so I've kind of got the whole talk down, and I run through it very quickly. It's a lot of information out there. It's a lot of important information. So I just wanted to share here a couple of resources that we use and we recommend to folks. The biggest one here is right at the top. It's the coronavirus.delaware.gov. That is the repository for everything Delaware coronavirus. There's information there for just regular people, for businesses, for child cares, for medical providers. That's where you want to go to start looking for the answers to any of the questions you have. There's some screening information out there, cleaning guidance, and then the EPA disinfectant list. But really, that first link will get you to those other three. So anything you need coronavirus related in Delaware, you should be able to find on that website. And if you can't find it on that website, then you can email me. And as the environmental health director, I can connect you with folks that can answer questions about testing, whatever else you might need. So if there's something coming up that you're not quite sure of, have a question that you can't get answered, feel free to reach out. We're always available, always happy to help.
Good afternoon.
Great.
Thank you for joining us.
Thank you, Jamie. Jamie, can we have a copy of that presentation that we can send as a follow-up to the participants so they have that information?
Absolutely. Absolutely.
Great.
I will send that out this afternoon.
Okay, great. And so with any of those links and things like that, we'll make sure that we get that out to you so you have those resources available as well. So we're going to move on to Todd. I know Todd is here. I think Heather was going to help answer some of the questions, but I'm not sure if she is on yet. So I'm going to turn it over to Todd.
Yes. Hello, everyone. My name is Todd Hartsock. I am the Senior Community Educator in the Office of Health Equity at ChristianaCare. I do apologize. I know we were hoping to have a representative from Wilmington Pediatrics. I'm not a doctor. However, I do work in the community in the work that I do. My role is more community-based, connecting people to services and resources. What I will talk about are some of the testing sites that are available and how to get connected to those, as well as some food and additional resources. I will, again, just putting the disclaimer out that I'm not a doctor. I know that one of the things that Heather would have talked about is the importance of continuing to go to your pediatric visits. I know that for many people, many families, there is definitely a high concern as far as the safety and security of going to their primary care doctor or their pediatrician. But we do want to emphasize that it is still important to attend those visits. I know that in many cases, some depending on the site, some places are still doing in-person visits, but other places are have shifted to telehealth visits, so a visit with the doctor or pediatrician over Zoom. So if you have a primary care doctor or pediatrician for your child, again, my non-doctor recommendation is that you reach out to the office and see what is available with your specific pediatrician, and go from there. Unfortunately, again, I don't have much more than that, as I am not a doctor. What I will share with you all is, let me pull it up on my screen, some information on testing. So what we do know is that it is very important as far as controlling the spread of COVID-19 to get tested, and there are a number of locations and ways that you can get testing. ChristianaCare currently operates 2 sites, one at the Latin American Community Center, LACC, that is operational Mondays and Fridays from 10 a.m. to 1 p.m. Hopefully you all can see my screen right now. There's a number that you can call to schedule an appointment. We also operate at the Kingswood Community Center on Tuesdays and Thursdays from 10 a.m. to 1 p.m. and that number is available as well. In addition, the Department of Health in Newcastle County have sites that they operate on a weekly basis. These tend to change depending on the week. What I have available right here is just a snapshot of the rest of this week sites that are available. This is statewide, so that's why you'll see Dover and some other locations like Milford that might not be close to you. However, there are some other additional drive-up sites and walk-up sites available. As far as the rest of the weeks go, like Jamie mentioned, there are a few websites that you can go to in order to find out where testing sites are available nearest you. The coronavirus.delaware.gov site is an excellent resource, as well as the Newcastle County website. I have both of those listed. And then what is recommended, not necessarily always necessary, but what is recommended for a lot of the drive-up sites is that you schedule in advance to have an appointment. And so this Curative Inc. Website is where you can go to schedule an appointment. Not all of the testing sites available are on this website just yet. So that's why I included some other sites where you can also check again to see what locations are available. I will share this and the other flyers and information that I have with Diane and Tiffany so that they can disseminate that out to everyone. I also would like to share, let me stop sharing this and share some information on some food resources that are coming up. So in the work that I do, we do a lot of work with the Food Bank of Delaware. My colleagues that I work with and we often receive food referrals from within the community, and a lot of times we are picking up and dropping off food to folks that are unable to make it out of their homes. The Food Bank of Delaware's warehouse in New York is available throughout the week. Delaware residents are able to go there to pick up, and they give you a decent amount of food. It's about enough food for about a month, depending on the size of your family. All you need is an ID or driver's license in order to receive the food. But they also have some mobile pantries that pop up from time to time. I'm going to share flyers for some of those that are coming up. There's one this Friday, and there's another one next week as far as August goes. Let's see. This is the one for next Wednesday. This one will be at St. Elizabeth's and in Bear. And there is a website to register to participate in that pop-up site. It's at 1 p.m. Again, that's in Bear. Let me share the other mobile food site in just a second. Here's the one for this Friday this is in Milford. I'm not sure if we have anyone on that is in Lower Delaware, but this Friday in Milford at 11 a.m. in the Brandywine Counseling Center. There will be distribution going on there as well. I'm going to also in the chat put a few phone numbers if you know of someone, if you or someone you know is in need of some more basic resources, like food and other things. There are some numbers that you can call to connect with individuals from the team that I work with in order to get connected to those services. Again, I will be available to answer whatever questions that I can. I apologize again that I'm not a registered nurse, but I will. What I will do and make myself available for, if there are specific questions about connecting with your pediatrician or the importance of going to your visits, I will personally write them down and make sure that I connect with someone from our Wilmington pediatrician office to answer those questions. And again, I will forward those to those responses to Diane to get out to everybody. I apologize that that's all that I can offer, but I will try my best to do what I can for you all. Thank you all for having me.
Thank you, Todd. And Todd, I'm going to be sure to get those flyers too, so that I can send that out as a follow-up resource to everybody. Okay, next up we have Lucinda.
Okay, I muted before because that was my dog barking in the background. So hopefully he'll behave himself from here on in. Good afternoon. I'm Lucinda Ross. I'm the Executive Director at St. Michael's School and Nursery, and I'm also President of the Board of DACY, which is Delaware's affiliate of the National Association for the Education of Young Children. What I think I have to share that might be helpful today is just the story of what St. Michael's has done with this COVID, and just as an example of one journey, so to speak. So I did make the decision on March 13th that St. Michael's would also close as K through 12 schools were closing. I also became a very active and probably sometimes too vocal member of a task force looking into all the aspects of it, you know, certainly financial and POC and safety and all those things that we as childcare providers have a very kind of idiosyncratic way of looking at things and what our practice consists of. So we stayed, St. Michael's stayed closed until June 29th. And during that time, we went through various trainings. My admin has probably been on more Zoom meetings than, well, I won't say more than Diane or Jamie, definitely, but we've been on a lot and really sought to educate ourselves as best we could. So when we opened on the 29th, we'd had a whole week of training, including just dry runs as to what would happen if we have a facility where we are able to have 4 entrances. So you are given, families are given the entrance, the color-coded entrance that they go to. They don't go in, no families inside the center, but they go to where children are, the temperatures are taken, they are screened with questions, and then the children are handed over to one of their teachers who takes them into their classroom. And staff is also goes through this whole thing before they come into the building every day. So we followed those rules, and for the first 2 weeks it was great. And then on the 3rd week, we had a positive case of COVID in one of our staff members. Unfortunately, I was not convinced, I was not comfortable with the fact that we had been very careful about not cross-contaminating, so we closed the whole center again for 2 weeks. We reopened on August 3rd, and then this past Monday, we had another positive case of COVID. And this time, this was after being extremely vigilant and doing all the things that Jamie mentioned, and even more sometimes. We are, right now our enrollment is about 65% because we're being very conservative about how many children can be in a room. how many children can sit at the table and eat together. Those cute little tables that used to have 6 children eating, they have 3 now. So even with all of the things that we have done and the practice that we've been so vigilant in following, we have 1 more case of COVID. So fortunately, I feel pretty confident that these people are really following the rules. So it's just the 1 classroom that now everyone is in quarantine for 14 days. And we will follow that and continue to follow that. So our enrollment is down to about 64%, and the attendance of that enrollment is about 64%. So that's the other thing for folks to know is that there are people who are enrolling and wanting to come back, but on any given day, it's more difficult for parents to think about sending their children in. And I do think that that's one of the things that right now I'm dealing with as much as anything, and that is the anxiety. You do everything that you're told to do, but it's out there. And actually, Jamie, you said that earlier, it's out there. The Latin American Community Center had stayed open as an emergency center from day 1. And I remember hearing one of their folks, Karen Hart, I think is her name. She's great. And I remember hearing her speak in one of these Zoom meetings and saying, folks, it's not a question of if, it's a question of when. It's going to happen. You do all the precautions, you take all the measures, but it is going to happen, and just be ready. I think one of the things that I have heightened is just my communication with parents. There's a Friday memo that goes out every week. When we found out on Monday, I think at about 1 o'clock that this young woman, the test had come back positive. We were on the phone, we were on emails, immediately telling folks. So I don't know if I can say it's brought our community together, because who feels like we're together these days? But I think it has, like I said, I think it's heightened my sense of responsibility to communicate swiftly and transparently through all of this.
Thank you, Lucinda. So at this time, what we were going to do is open up to the chat box to any questions that you might have. We did have several people email some questions prior to, so as our participants put in any questions that they might have in the chat box, I'm going to just kind of go through some that were emailed to us ahead of time. First, I'm going to start this one off, and Lucinda, since you're just freshly started and just told us about your story, can you tell us like a little more detail about like all of the different precautions that child care centers are putting into place to keep kids safeguarded?
So, absolutely. So the first thing that we did before we opened is administration. We went through every room and we had our tape measure, and we measured 6 feet between cribs. You can't always get 6 feet, but at very least 3 feet between cribs and head to toe, arrangement. So that was the first thing we did. And then, as I said, we figured out tables. So children can no longer eat in the cafeteria. Everyone eats in their room. So how could we set up the tables so that, again, children are at least 3 feet apart while they're eating? That immediately brings down the enrollment, as I said, for St. Michael's anyway, to about 67% of that. That was before we even opened the doors. We have PPE supplies delivered every week. We have masks, we have gloves, we have face shields, we have sanitizers, bleach, you name it. And every room has their own little cachet that they use every day. We have cleaning checks. There's a checklist that folks use every day, and the teachers in the classroom. As I said, we check temperatures on the way in, but we also recheck temperatures of everyone, teachers and children, at 11 o'clock every morning and then on their way out the door. Cleaning is huge. So we're lucky at St. Michael's that we have some great outdoor spaces, but those outdoor spaces get sprayed down and wiped down, and jungle gyms or things where kids are really holding on to. So teachers know to do that on their way out. We're very careful about the staggered trips to the playground so that no groups are there at the same time or passing in the hallway. I think I mentioned we have 4 different entry levels for families. I think the hardest thing for us right now is the staffing. So one of the things that we were worried about with the first case is that we had folks who were delivering children to classrooms, but it wasn't just one classroom. They were delivering them to maybe 2 or 3 classrooms in the same wing. So we've stopped doing that. So now what we have is we have 2 teachers in each room and a small enough enrollment so that when it's down to 1 teacher in each room, it's still within STARS ratio. So it's very tricky, and our hours right now are highly minimized. We used to be open from 7 to 5:30. We're open from 8 to 4 now, and mainly because of the staffing. We just simply cannot staff a full day as we used to. You can't combine groups. It's very difficult, but I've said over and over again, when this is all done, I have a reputation of being a fuddy-dud in Delaware. I can live with that.
Thank you. Okay, so next, and I think that this question, Todd, you talked about this, but you talked about some of the testing sites. There's been a number of questions on what exactly is the process at the testing site, and are the testing sites available for children and adults, or is there separate sites for that?
All right, thank you. So I hate to give a political answer, but it depends on the site. There are sites that like I mentioned, you can just walk up without previously registering and just show up and get a test done that day. Other sites do prefer you to make an appointment. Off the record, most places, if you come and you are concerned about potential exposure, they'll figure out a way to get you either seen that day or get you on the schedule so that either at that particular site or at a different site so that you are seen. And there's also a number of different approaches to testing. I'm sure many of you have heard and maybe been afraid of some of the ways that they test with the nose swab. In some cases, they are just swabbing like the rim of your nose. In some cases, they are taking a swab or much further up your nose. And there are also some testing sites that are now offering the saliva kit, which allows you to swab yourself, put it in a test tube, and return the kit that way. And so, as far as what the protocol is, it does really kind of depend site by site. On the sheet that I'll send to you, Diane, there's more information, and if you just call the particular site that's closest to you, they'll be able to let you know what you need to do beforehand. I know that there are also some like locations like Rite Aid and in places that are occasionally offering testing as well. But it's just a matter of making the call. And if you have any questions, we have some lines that'll be on that sheet where you can reach out to us and we can get you connected to the right people.
Great, and I know this might also vary by testing site, but one of the questions we got was, how long does it take to get the results back? So
what we've seen is anywhere from same day to within 72 hours. 72 hours has in my experience has been like on the longer end. Most sites are typically within, I would say, about 48. But that blanket is just, again, depending on where you get it done, it can be as swiftly as same day, but potentially up to 72 hours.
Thank you. Jamie, it looks like this next question is for you. What questions should we be asking about building ventilation as we head into winter? A lot of these schools are in older buildings.
Yeah, so we've gotten a lot of questions about ventilation and things. And right now, whatever we can do to open windows, open doors, keep fresh air moving in, and increase the introduction of fresh air into the facilities in a safe manner, we're encouraging folks to do that. Obviously, as we get towards colder temperatures, that's going to be a little more difficult. So we're not, going to suggest that you keep windows open, and freeze the kids out of the classroom. But if we have milder days in the fall, we want to continue to use windows, continue to use that fresh air introduction. If the mechanical systems for the building are able to introduce fresh air, that's another potential option, but that needs to be evaluated, kind of on a case-by-case basis. It's tough for us to provide recommendations in general about ventilation, just because there are so many types of buildings and so many ages of buildings that there's not a lot of one-size-fits-all type stuff. But the big things heading into winter are the standard recommendations that we would make. And that's make sure if there's filters in the system that they're changed regularly. If the system can be balanced, make sure it just has all of the regular maintenance and regular attention that it normally gets. There's nothing additional we're recommending at this time.
Great, thank you. A couple other questions that we had is, what is the exclusion temperature and recommendations if a child is sick?
I'm sorry, was that one for me?
Sure.
Could you just repeat that question for me?
Yeah, so there was just a few questions about just many places that you start to go now are asking you if you've had a fever or if you've had some symptoms and things like that. And so what is kind of that what's that magical temperature of, for a fever? What is that considered when you're looking at potential COVID symptoms?
So there's two numbers that have been used for that in the CDC and public health guidance. Initially, we had used a number of 99.5. Now we have transitioned to 100.4. And the 100.4 is more the classic definition of a fever. So at that point, if you have someone that has 100.4, they have a fever, they should be excluded, until they can either find the underlying causes of that fever and take, appropriate actions. I know that child cares have specific requirements for, I think it's 48 hours after symptoms resolve in a normal case. If it's COVID related, obviously there's guidance out there for that as well. The 99.5, if you have somebody that comes in and they register the 99.5, it's not a bad idea to just have them sit for a minute if it's a hot day. If they just came in from outside, maybe they cool down a little bit, or ask them, some of the follow-up questions and just have a bit of an additional conversation with them to see if we can make, determine if there's a cause for it or if it's just that they're running a little hot that day.
And Jamie, can you also talk a little bit more about those screening questions, what exactly those are? We have some families that have been to childcare programs and get those, but then we have some families that aren't really even quite sure what type of screening questions are going to be asked of them.
So really the biggest thing with the screening questions are the symptoms. And, those are things like the loss of the sense of taste or smell, the fever, congestion, and I'm not going to try and go through the whole list because I know I'll miss one or two. But the symptoms are listed both on the coronavirus link that I mentioned before, as well as CDC web pages. And basically, they're going to ask you if you've had those symptoms. And if you've had those symptoms, then they're probably, just like we talked about with the 99.5, there's an additional conversation that needs to be had. One of the symptoms is congestion. So if you are trying to access a facility, they ask you about congestion, you say yes. then maybe you need to have a conversation with them and say, oh, well, you know what, I have seasonal allergies, so that's probably what that's related to. And, just it's at the discretion of the facility how they want to handle those conversations. But in general, if it's something that can be identified as a non-COVID cause, then it's just something to keep an eye on and be aware of. If it's not something that's normal for that person and may be related to COVID, then, we might encourage them to contact their primary care provider and just kind of follow up with them to see if it is something related to COVID or, perhaps another condition they need to have addressed.
Great, thank you. I see in the chat box, somebody asked a question of if parents choose to do virtual learning in a home childcare setting, will there be volunteers able to assist other children? This is going to be a question for licensing. So what I can do is make sure that this question gets forwarded on to the Office of Child Care Licensing so that they sort of have that information, and that can be something that they would make a decision on. Any other questions that we have from our participants? Okay, so I don't see any other questions coming in. So did you have any, I'll start with Jamie. Jamie, did you have any final thoughts on anything that anybody needs to know, that families may need to know about health and safety?
I think we've covered a lot. So I think that just opens the door for more questions and, uncertainty down the road. So I want to encourage folks to reach out. I'll share the slides from my presentation so they can be distributed. That has my email address in it. There's also another email address that I'll include in that information, and that's hspcontact@delaware.gov. That is something that can be used for general questions about cleaning and sanitation in businesses, childcares, what have you. It can also be used as a way to inform us or bring us up to speed on complaints or concerns that you might have about businesses. One of the things that my section of public health has been doing the last couple of months is addressing those concerns and doing site visits to businesses throughout the state to make sure that they're all kind of keeping up with what they need to do. So I would just encourage folks that if you have questions, concerns, feel free to reach out.
Great, thank you. Todd, did you have any final thoughts for our participants around health and safety?
I think all my thoughts would be just to continue to practice all of the health and safety things that you've been doing, the social distancing, the wearing masks, like we've already been talking about, and just everybody, you know yourself, you know your health, you know your family, and your needs. So if something feels off, if you're concerned about something, don't hesitate to reach out to your primary care doctor, or if you don't have a primary care doctor, don't hesitate to reach out to a health clinic somewhere, just to ask, because the best way for us to, again, do what we need to do to slow the spread of this virus is continue to test if anybody is symptomatic or potentially been around someone that is exposed. So just keep doing all the recommended things from the Department of Health, CDC, and anywhere else that is providing that kind of information. Just be safe.
Great, thank you. Lucinda, any final words?
My final word is always about children, and having been a director through 9/11 and living in Boston during the marathon bombing, all of those things, this is just pay attention to what your children are going through. I think sometimes we just think that it's going to roll off their backs. It doesn't roll off their backs. They absorb everything. So make sure that you're just not telling them anything more than they need to do, but to have some honest conversations about what's going on. There's also a lot of resources for that. We have some really wonderful things going on out there, and you can definitely go to the DACY website. We have actually have a COVID page of resources, and don't hesitate. And you can always contact me at St. Michael's. I'm happy to pass out information and resources. And good luck.
Thank you, Lucinda. And thank you to all of our panelists and to all of our participants for joining us today to learn more on the topic of health and safety. As I did mention before, you're going to receive a follow-up email that would have all of these resources that we talked about, as well as a link to this recording of this meeting. We also do have a lot of resources on the Delaware Readiness Team website. It's www.delawarereadinessteams.com. So you can certainly visit that for additional information and resources for children and families. And we are going to be holding a mental health family information session on Tuesday, September 22nd at 1. So save the date for that. More details will follow. As we talk about health and safety, certainly mental health and social emotional well-being of children has been at the forefront of many of our minds, and we are definitely experiencing times now that we have never before. And so we want to make sure that we're providing some supports on how to best support not only the children as they go through this journey, but the parents as they help children go through this journey. So more information to come on that. And then we also want to continue to listen to families throughout the state. So if you have any ideas for additional resources or things that you would like to see, feel free to send an email to the Delaware Readiness Team's Gmail account, and we will be sure to follow up with those resources or get you in contact with some of our partners that can answer some of your questions. That family voice is so important, and we want to make sure that we're best supporting you. So once again, I thank you for joining us, and I hope you have a wonderful day. Thank you.
Thank you, Diane.
Thank you.
Thank you.